You've got a dog, comes to you, diagnosed with distemper, having seizures. What do you do? Take us through it step by step.
The sooner you treat it, the better chance you have of control. If you wait till later and there's enough damage, the dog's going to die regardless. You've got four kinds. The one coming up the backbone, you got to do it pretty quick, because once it reaches up into the thoracic area, it turns off the ability to breathe, and you're not going to do anything to save that dog. The optic neuritis, it turns out it treats it really quickly. We're talking sometimes less than a week. These dogs go back to being sighted, and I find that extraordinary, okay? The seizuring dogs, I think it would take a little bit longer. The ones that we treated in Indonesia, the seizuring dog was also blind. It regained its eyesight within a matter of a week or so. The seizuring took about 4 to 6 weeks to come under control. The dog with chorea, I'm trying to think of the amount of time. I think it was 4 to 6 weeks also, and the chorea stopped on that dog. And that dog was paralyzed in the hind legs when we treated. It could not walk, okay, and it did walk. The dog we treated there could not walk, could not see, was sighted and walking within a matter of 2 weeks. The one we treated in UCLA. Mm-hmm. So that's been documented, but never printed, never published. If you have a dog with seizures and you suspect that you're dealing with distemper, remember that list I showed you?
Right.
Because it could be any of those things. You want to tap the brain. You want to give it an anesthetic, prep it for surgery. You want to tap the brain, and you do that by doing it through the foramen magnum, and you want to pull some of that material off. You want to get some. Then you take the same needle, leave it where it is, and you put in about a half a cc, depending on the size of the dog, of active NDV virus into the brain. Then you follow it with a flush of saline. Why that? So that essentially you flush the needle and you get it all in there, because the needle's going to have about probably 2/10 of a cc stuck in it, and you don't want it left in the needle. Okay. Now I had somebody write to me and say they made the NDV up with saline rather than the distilled water, and they didn't get any seizures. My experience is that every time you put NDV into a dog, you're going to get seizures. Okay, so you need to have a catheter into them for fluids, and you need to have them anesthetized when you do it. Okay, but this individual wrote to me and said we gave it with saline mixed with the NDV. It worked just as well, and we didn't have any secondary effects from it. Okay, so yeah, I would do it that way. Can we use the serum? I don't see any reason why it wouldn't work, but you couldn't just put a needle in. I wouldn't want the dog anesthetized and a needle put in 2 or 3 times a day. I would put a small catheter in there, very tiny catheters. Because what you're really after are the cytokines. Those cytokines are taking whatever immune system you got in that brain and saying, get rid of that virus now. Also, there seems to be an anti-inflammatory part to this. Why do I think that? When we talk about cats, I'll discuss that, because that's the only place where we really see what I consider to be an anti-inflammatory part to this.
You're talking about putting the needle into the spinal canal.
Spinal canal, yes, right. Not the spinal cord, but the canal.
Big concern is whether or not you might nick the spinal cord.
Yeah, that's called pithing. Yeah.
Right. Now,
yeah, right. So somebody that knows how to do that needs to do it.
Right. Do they need to use ultrasound, or can they just, do they need to use an ultrasound to guide the needle, or can it be done?
No, I did it without an ultrasound for years without a problem, because I also did spinal surgery. Okay, we drop needles in, and you can close your eyes, and you got the dog in position. You got your fingers on it, and you got the needle right where you want it, and you can feel your way down the bone. And you pop right through there's a thick membrane there. You can feel it pop right through that, and you don't need to go any further. You're there, and then what happens is the fluid comes up through the needle. Okay, so we would put a catheter on the needle and pull the fluid off. Mm-hmm. Okay, because that way you didn't bother the needle. Then we would pull the catheter out and inject the NDV into the needle. Now, 2/10 of it's stuck in the needle, okay? Probably 1/10 because you're using a very tiny needle. Then flush it with a little saline, then just pull the needle out. I mean, the whole thing takes 5 minutes, 2 minutes. Okay. The trick is to walk it down.
So it's like a spinal tap, but up in the brain area. It's like a spinal tap.
It is a spinal tap.
But in the brain
area. It is a spinal tap. Exactly what it is.
So that pop that you feel.
I've had some people that weren't quite as adept injure the neural cord. Some guy in the Philippines apparently pithed the dog, and the dog had trouble walking for, just cut his legs off, literally. And then I had another case where the dog had been in the field with cows, and so it had cow shit all over it, and apparently the guy didn't clip it and prep it for surgery, and they got tetanus from putting the needle in. So the dog had tetanus, okay? So he says, just NDV caused tetanus. No, it doesn't. But that doesn't mean you can't get tetanus when you don't do it cleanly. It requires that you do this in a surgical manner.